I can tell you from my past experiences, there are no better people on this planet. There are no better people on this planet than the folks that work in this hospital.
One of the things I think is really pretty strong at Howard County General is the level of friendliness and respect and camaraderie. We do multidisciplinary rounds with the nurses, but we text each other. If a nurse says, I'm worried about something, can you come look? We come. So I really feel like my patients are in good hands.
Just the way the nurses are with each other, we are like a family here.
You are taking care of that patient, their needs, their medicines, taking their vitals, but you are having that conversation with 10 family members in 10 hours, 10 different ways, and answering the same questions over and over. And the whole time they are taking that deep breath and answering it again, and explaining it more, explaining it less, whatever it takes, because nurses realize that it's so important for the patient to understand, but everyone else that's tied into that patient.
Most of the nurses I know have studied hard to get where they are. And they do a great job. And they do a great job because they prepared themselves for it.
And then, of course, in the hospital, I mean, nurses are the ones that pretty much run the hospital. You know, the nurses are the ones that are directly responsible for the day-to-day patient care, all the medications that are given, IV fluids, you name it.
The only way this process works is with a team, and our team includes the doctors, the interventional cardiologists, but also the nurses both in the cath lab and in the ICU. And we have developed a process where it's largely nurse-driven.
But the nurses were wonderful with the way they treated me. So I really speak highly of all the nurses in the hospital. I know quite a few of them, and they're very wonderful people. They do a lot for you. I mean, they're the bedrock of the hospital, really.
Nursing is a calling. And I think amazingly special people go into this field, including my mom and my sister. And it's so nice to know that we have people who choose this to really make a difference in the lives of others. And I think nurses are very special. And I thank you for what you do.
Thank you very much for everything you do for your patients.
Thank you for all that you do. We couldn't function without you.
So thank you, nurses, for all you do, and thank you for being part of my team.
Thank you to all the nurses at Howard County General Hospital.
You all have helped me wonderfully, and thank you very much. I appreciate it.
Thank you.
Or what they say. It's gone. I don't know.
Tree? Well, that's not. That's just a pump.
Okay. Okay. Okay.
I love our nursing staff.